senator from California.
Mr. President, we have seen an array of my Republican colleagues come to the floor, which is their right, and I'm glad the government's open, so they have their staff to help them prepare their speeches. But I have to say, this is typical of the Republicans when it comes to health care. All they do is criticize, and not one, because I monitored the speeches, gave one new idea of how to make sure that our citizens are protected with the insurance they have, or how to insure the 48 million uninsured Americans. Not one, but this is the way the Republican Party has been for years. Let's look at what happened when Medicare came to the Senate floor and to the House floor. Medicare, which is one of the most beloved programs. 60% of Republicans in the Senate and 50% of House Republicans voted against Medicare in 1965. Representative Durward Hall, a Republican of Missouri, said, quote, "We cannot stand idly by as the nation is urged to embark on an ill-conceived adventure in government, the end of which no one can see and from which the patient is certain to be the sufferer." This is typical of Republicans through the generations. Every time we've tried to expand health care, they've opposed it and tried to derail it. Senator Miller Simpson, Republican of Wyoming, said, "I am disturbed about the effect this legislation would have upon our economy and upon our private insurance system." That's what they said about Medicare. And they read horror stories. About it. Now, here's what the Republicans aren't saying. They are saying that there is a problem with the health care law that needs to be fixed, which is that people who want to keep their substandard plans are having trouble keeping their substandard plans. Now, President Obama has already said he's going to fix that. There's legislation to fix that. We'll fix it. But that's not good enough for my Republican friends. They just want to tear it down, just like they wanted to tear down Medicare. More recently, they wanted to tear down Medicare. So this is an ancient history. Let's be clear. In 1995, Dick Armey, the Republican House Majority Leader, said, Medicare, quote, "is a program I would have no part of in a free world." This is the Republican sentiment about health care being offered to our people. The same year, after leading an effort to raise premiums and costs for seniors, Newt Gingrich said Medicare was, quote, "going to wither on the vine." And now we have Tea Partiers standing there saying, "Hands off my Medicare," okay? That's how out of touch the Republicans are with where the people are. Senate Majority Leader Bob Dole bragged in 1996, "I was there fighting the fight, voting against Medicare, because we knew it wouldn't work in 1965. And now Paul Ryan's budget ends Medicare as we know it. So let's be clear. When you see almost the entire Republican caucus come down here and try to repeal the Affordable Care Act, this is not just stemming from today or yesterday or a glitch in the website or a problem that we have to fix about people losing their substandard plans. If they want to keep them, we'll figure out a way to help them fix it. Notice that they never said anything about the good that the Affordable Care Act is doing for millions of people. Because of the Affordable Care Act, Mr. President, 3 million young adults are now insured on their parents' plan, and yet they want to repeal the Affordable Care Act. What's going to happen to those 3 million young adults? 71 million Americans are getting free preventive care, like checkups, birth control, immunizations. 17 million kids with pre-existing conditions like asthma and diabetes can no longer be denied coverage. So, they want to talk about people who are having a problem. We're going to fix it. We think it's about 5% of the people, but even if it's 1%, we should fix it. Now, yesterday, we learned that in the first month of the open enrollment period, 106,000, or 1.4% of consumers, are going to sign up. If you look at Massachusetts during its first month, and Mr. President, I'm sure you're aware of this, being in New Jersey, close to Massachusetts, only 0.3% or 123 people signed up for coverage out of the 36,000 who ultimately signed up in the first year. So let's be clear. We all wanted to see bigger numbers, but the Affordable Care Act numbers are 4 times better than what Massachusetts did in its first month. And if you talk to the people of Massachusetts, they love their health care plan. And our plan is based on their plan. By the way, a Republican plan. Hundreds of thousands have started the enrollment process, and I'm one of them. I've created an account, and I'm going to go shopping and buy my plan. But I'm taking my time because I have some time till December. I'm going to discuss it with my husband. We're going to decide what's best for us. I'm going to sign up. You know, I think it was Secretary Sebelius said, this isn't like buying a toaster. This is a commitment for a year, and you've got to take your time. So don't come here and tear down the Affordable Care Act without having to put anything in its place and focus on one problem that the president said he's going to fix, and we're going to fix it. Things are going to pick up. I want to tell you the great news about California. Just in the first 2 weeks of November, California's enrollment has doubled. Our story is a really good one. There's a huge amount of interest in California. People are enrolling. We do have a good website. That's important. People are finding affordable care health options. At the end of the day, when the kinks are worked out, I believe the California experience will be repeated across the country to the benefit of all our families. So let me break down some of the numbers from California. We are the largest state in the union. And we're always, I hate to say this to my friends here, but we're always ahead of the curve. And during the month of October, 370,000 Californians began the process of signing up for private coverage or Medicaid through our health insurance marketplace, Covered California, coveredca.com. Of those, over 30,000 Californians enrolled in health exchanges plans, and over 72,000 applied for Medicaid. So let me just say, we are off to an excellent start in California. In October, there were more than 2.4 million unique visits to Covered California. In other words, this doesn't count people going back and back, unique visits. And more than 249,000 calls were made to Covered California call centers, and they've got it down to just a couple of minutes of wait time. To date, more than 17,000 counselors, agents, county workers, and others have been certified to offer in-person assistance to Californians. But look, you've heard the horror stories from over there. One side of the story, people having a problem, we're going to fix the problem. Let me tell you and quote to you what Californians are saying. And these are all quotes. I enrolled online on Monday, exclamation point. No website troubles, exclamation point. Took me about 15 minutes, exclamation point. I'll be saving $628 a month after January 1st, exclamation point. So grateful, exclamation point, unquote. Very short wait on the phone. This is another. Helpful, cheerful person to talk to. This online app is very easy. Thank you. And another. The insurance package I'm getting is more comprehensive and way cheaper than the one I've had for the last 9 years. Thank you for creating the marketplace and making the information more accessible and understandable. Another. I find the new coverage provisions to be amazing compared to what was out there before. Many of the plans are cheaper than anything I've seen before, and the one I chose has zero deductible. Another, simple, straightforward, and intuitive. I haven't had health insurance since 1985, so this site has made it unexpectedly easy to enroll. Thank you. So, what we heard from the Republicans is, from a group of people we're going to help who have substandard plans. They don't meet the standards of the Affordable Care Act. Sometimes they're called junk plans. Some are a little better than junk. Many of them are not there when you need them. And people, I have to say, to come down here and echo that sentiment without saying the good things that have been done is outrageous. I'd ask for 2 more minutes.
Without objection.
So we now know the history. We now know, because I shared with you, the history of the Republican Party. Sad to say it, but they opposed Medicare when it went in. They tried to tear it down. They still are trying to tear it down in the Ryan budget. They come down here and they talk about a problem that exists that we're going to fix. They never said the president's going to fix it. He may be on the way to fixing it in moments here. But they ignore the fact that the signups are ahead of where Massachusetts was at this time. So let me close. Sage McAllister from Castro Valley told me how the law is helping her family. She was able to get insurance for her 7-year-old daughter, Leah, who was born with an autoimmune disorder. Sage said that before the Affordable Care Act was passed, she applied to 8 different companies to try to get insurance, but none were affordable. After the law went into effect, she was able to get insurance for Leah for $8 a month. Leah was able to get a procedure done to treat a spinal cord problem that could have resulted in paralysis. Sage said that without the Affordable Care Act, my family, and this is a quote, would be bankrupt, and Leah wouldn't have gotten the health care she needs. Obama saved my family from financial ruin, said another constituent, Jeanine Reed. So here's the deal. Let's be fair. Come down to the floor, one after the other, and shed light on one problem we're going to fix that the president said he's going to fix, and then say you're going to repeal the whole thing. You sound just like your predecessors who said Medicare, terrible idea, Social Security, awful idea. That's what this is about. We're going to make history here. We're going to do the right thing. We're going to fix the problems. And there will be more, because that's what happens when you are tackling this big issue. But at the end of the day, we will be a better nation, a healthier nation. Our children will have a brighter future. And I'm just here to say, I stand with those who want progress. We're not going to tear something down like they want to do and go right back to where we were before, with parents like these having to choose between feeding their families and giving their kids health care. Thank you, and I yield the floor.